I was also asked in this to incorporate other current events. And so we know that there is a lot of race-based violence that's been occurring in tandem with the pandemic, unfortunately. And so this piece is talking about collectively grieving as Black people, so racial trauma during the time of COVID-19. So these are just some basic statistics regarding Black and brown people and the numbers. And the numbers are disproportionately higher in terms of infection rate as well as death rate. I was looking at here in Pennsylvania, Black people represent a very small percentage, yet we represent almost 60% of those who are dying as a result of COVID-19. And we talk a little bit about here in this slide, the inequities. So systemic racism, and it's being embedded in all the systems, the healthcare system in particular. And as a result of that, that means lack of testing, lack of resources, not being believed as Black people when they go and they report experiencing symptoms and they're turned away or they're sent home. There are many stories, unfortunately, that have the same end, you know, folks dying or being very, very ill as a result of not being listened to, not being tested in enough time, and not being treated. And all as a result of the color of their skin. And so next slide, please. And so I wanted to talk a lot about it in terms of the race-based trauma and the race-based violence leading to the racial trauma. But I didn't know how much time I had to really delve into it. But I just wanted to say before I get to this piece that it compounds the implications of what we're currently experiencing. I know for myself as a Black woman who is a therapist, who is a mother, who is a wife, who is a daughter, who is a sister, it has significantly compounded my experience of not feeling safe. I'm a person who jogs, I bird watch, I take nature walks, I sleep in my bed, I drive in my car, all the things that, as we've seen on the news as of late, have gotten Black people killed. And so it is very challenging as a Black woman living in America and leaving my house every day and feeling concerned for my own safety, as well as the safety of my husband, my son, and my daughter. And so when we think about that in relation to COVID-19 and we think about immune system and et cetera, the stress can definitely significantly impact my immune health, which then makes me more susceptible to contracting COVID-19. And for many Black and brown people, that has been, you know, a significant factor. You know, racial trauma is definitely a cause of post-traumatic stress disorder. They have made modifications and will continue to make modifications in our diagnostic tool, the DSM-5, to further, because it was a very big mention of it in terms of race-based trauma and its implications, but they're looking now to expand that understanding of how racial trauma does, in fact, lead to post-traumatic stress disorder. The racial inequality that leads to the issues in the healthcare system are the same ones that lead to the violence that we see played out in our world, unfortunately. And so when I was thinking about, like, what can we do? Because I know this is very bleak and difficult subject matter to navigate. So I was thinking about ways that we can collectively respond. And so I wrote a little bit about what can we and public health officials do to address racial inequities in healthcare. So, you know, one of the things was collect and analyze and report data in ways that shed light on the disparities and the things that actually drive, you know, the solutions. So that has been a challenge in terms of finding information, research that speaks to how does systemic racism significantly impact the service provision in terms of healthcare and other systems to Black people, and how that, you know, impacts them. I think we're having more of those conversations, which I think is great. But I think that now is more of a time of action, like what do we do with what we know? And so these are some other suggestions in terms of linking people to testing and care for COVID-19. One of the things that the Black Doctors Organization has done is that they have made free testing accessible in Black and Brown communities, which has been really amazing provision. And I know that it has definitely thwarted many people from either, getting very ill or dying because they had access to testing. And the other thing is training community healthcare workers in underserved communities to educate them and link them to free and low cost healthcare. So being, aware of what additional services are available in the community and being able to connect people to those services, as well as getting faith-based community organizations and educators, et cetera, on board in terms of being able to, again, access information, access resources. And then it talks about also linking more people to healthcare services that may not normally get, have access to those services. And one of the things that I know to be true from my work abroad is that representation matters. And seeing people that look like them help them to trust more readily, because Black people don't have a lot of trust for the healthcare and the psychological communities because of, the historical context. And so that's something that I think many Black and Brown people are still, education, I think, is helpful in them being able to move beyond that and to trust certain institutions so that they can get resources and services that can be potentially life-saving.